Emergency services.
I've got an elderly man here. He's not responding. His eyes are a bit glassy. I'm fairly sure he's baked himself in the sauna.
Right, okay.
It's the start of shift for Taz and his new partner, rookie paramedic Amanda. Their first job tonight is a bizarre one.
He's baked himself in a sauna.
Does it say that?
Yes. He's baked himself.
Like a potato.
Baked in a sauna. I don't even know what that means, so I don't know what to expect.
First for everything, eh?
It may sound like a strange case, but with a patient who's not responding, the paramedics have been given a code 1.
Oops. Days. After you. Idiots.
Which means lights and sirens are authorised to ensure a rapid response time.
Yep.
Anytime.
If we just want to move, that'd be awesome.
Yeah.
Thank you.
Being so new to the role, I find every day is a challenge. I'm still learning so much. There's a lot of things that I haven't yet dealt with. It's potluck what you get every day.
Within 10 minutes of receiving the call, Amanda and Taz arrive at the aquatic centre.
Is he conscious?
He's baked himself in the sauna. He's just real glassy-eyed.
Okay.
Hello, how you going?
This is Michael.
Hi, Michael. What have you done? You're in the sauna.
I did some exercise in the pool first before.
Okay. How are you feeling now?
How much energy?
Do you have any medical conditions?
Suffering from gout and high blood pressure.
From gout and high blood pressure, that's everything? No heart conditions, no diabetes, nothing like that?
So a bit of an unusual scene. It's hot, really hot. Like Thailand, middle of typhoon hot.
To try to work out what's caused Michael to suddenly collapse, the paramedics check his blood pressure
What day is it? Tell me. It's Wednesday, good.
and attach electrodes to monitor his heart rate.
Just checking your temperature, okay?
So I start to notice that Michael gets a little bit more lethargic.
35.9.
I think something a little bit more serious could be going on.
Are you in any pain anywhere? In your chest? Can you point to the pain for me?
Taz and Amanda are becoming concerned their patient is rapidly deteriorating. The situation is now critical.
So, Michael, it looks like you're having a heart attack, my love, okay? It's not good, but you're with the right people. We're here to help you, okay?
Patient Rudy.
Yeah, he's a known caller. Just says he's feeling his heart race and states he banged his head on the table earlier today.
In Melbourne's CBD, Mike and Jamie have been called to investigate a man who has apparently hit his head and is now experiencing chest pain.
Address is usually at a boarding house.
Okay, right. Sweet.
Every 50 hours, a paramedic is assaulted while on the job in Victoria. So Jamie and Mike will be on high alert for possible threats when they walk into the unknown.
As a paramedic, we go to a lot of different places, most of them wonderful, but some of them are dodgy. Walking into a boarding house, we've always got to have that risk assessment going on because people will sometimes try and hurt us, and we've only got each other to look out for.
Yeah, so it'll be this one then.
Our safety is the most important thing because if we get taken out of action, we can't look after anyone else.
Across town, Taz and Amanda are desperately fighting to save Michael.
It looks like you're having a heart attack, my love.
The 63-year-old suddenly collapsed after being in a sauna.
To what, sorry?
An IV access.
When I see someone in that situation, I go straight into the clinical mode because every second counts.
All right, Michael, just know you're in good hands, okay?
Michael doesn't realize what kind of grave danger he's in. The consequence could be fatal.
Keep talking to me, darling.
The main thing we obviously want to avoid is Michael going into cardiac arrest.
Amanda attaches defibrillator pads in case they need to send an electric shock to the patient's heart to restore its rhythm.
His blood pressure's really low.
At the same time, Taz puts Michael on an IV drip to try to raise his blood pressure.
Keep talking to me. Do you have any children?
I have 3.
You have 3 children.
Amanda talks constantly to Michael to assess his level of consciousness.
What's your wife's name?
Putting the IV
I
access
don't
in
have a
now.
wife anymore. I'm divorced.
You're divorced, are you? Sorry to hear that. You're doing a really great job.
You're doing a good job here.
Oh, thank you. I must say, Michael, it's actually very nice to meet you. I'm sorry it's under such horrible circumstances.
It's a good sign that he was able to have a conversation with me.
Tell me about your children. Talk to me, Michael.
However, Michael's conscious state is dropping off.
I want you to keep talking to me, Michael, okay?
All his vital signs are dropping and very, very close to cardiac arrest.
Open your eyes for me. You just stay with me, okay?
I'm acutely aware that there are parts of Michael's heart that are currently dying. You get a blockage in the heart's not getting blood flow, it's not getting oxygen, and it starts to die.
Paramedics Jamie and Mike have been called to a boarding house to check up on 41-year-old Rudy, who has a history of chronic drinking.
Going to drug and alcohol jobs, it can be really challenging. These people can occasionally be quite belligerent, be aggressive, and we've got a responsibility to go and treat them.
Rudy, do you mind if we come in?
Yeah.
Yeah?
They might not have called us themselves, so they might go, who the hell are you? What are you doing here? So it can be really dangerous sometimes.
RC701, we've gained access.
Have a seat somewhere for us, Rudy. Sit on the edge of the bed for us, mate.
Knives on the bed.
Just keep nice and still, Rudy.
Your knives are okay, mate. They're just on the bed there.
You're definitely watching out for dangers. I usually just try and cover them, so that way if they're going for the knife, at least I know that they're going for the knife and I've got time to run.
What's going on, Rudy?
My chest is very painful. And my head as well.
The pain in your chest, Rudy, what does it feel like? Does it feel punching, stabbing, sharp? What does it feel like?
It's like a knife coming.
Like a knife. All right.
It soon becomes clear that Rudy presents no threat. This is a patient crying out for help.
Do you take any tablets? Whereabouts are they?
As well as his battle with the bottle, Rudy suffers from diabetes and epilepsy. Combining that with the bump to his head and chest pain, Jamie decides Rudy needs to be examined further.
We'll drive you up to hospital, Rudy. How does that sound? They'll look after you, okay? We'll give you a blanket in the ambulance and we'll drive you up to the hospital, okay?
Everyone's a bit different, and you can't really judge a book by its cover.
After you, mate. You don't need your sunnies. It's dark out there, mate.
That's something that's really important to me. All people have the right to healthcare, and they get the best healthcare from us.
In the bed, on the bed in there, mate. There we go. Good job, Rudy. Have a lie down. Pop your sunnies on. It's nice and bright in here.
Very nice. And these bloody classes, you know, it's a ladies' classes.
Yeah.
But they look very nice.
They look nice on you, mate.
Sometimes they do look nice,
They look beautiful on you.
Rudy is absolutely amazing and he absolutely rocks those sunglasses. It makes me want a pair.
So what's going on tonight, mate?
I have peace, mate.
Rudy is turning out to be an entertaining patient.
I had a crazy wife.
Why do you say that for, Rudy?
I say to myself all the time. You reckon that I am crazy?
No, I don't think you're crazy at all. Do you think I'm crazy?
Of course not, mate.
Of course not. Say yes, Rudy.
While Jamie and Mike bond with Rudy, back at the aquatic centre,
Sharps out.
63-year-old Michael has collapsed after a sauna and is now dangerously close to cardiac arrest.
I want you to keep talking to me, Michael, okay?
Taz and Amanda are working to keep Michael alive while specialist help is on the way.
We're just waiting for a Micah paramedic. Have you ever heard of Micah paramedics before? They're the ones that are super duper.
Mobile intensive care ambulance paramedics undergo years of training so they can deal with critical medical emergencies.
This is Michael. He's a 63-year-old male. He's got no medical history other than gout and hypertension.
That's good enough.
Yep.
Thanks to Taz and Amanda's quick response and treatment, Michael is already showing improvement.
That's it. Well done. Good job. Just up onto the stretcher.
Okay.
Taz. Thank you. Sorry. I'm coming with you, my love. I'm going to drive you in.
While the Micah team monitor Michael's condition on the way to the hospital, Amanda is responsible for getting him there as fast as possible.
Pull over, pull over, pull over. Come on, mate.
When you've got a patient in the back that's time critical, it's a sticky situation, you're tense, you're dealing with all of the traffic considerations in front of you, but always very aware that you need to get there as soon as you can.
Vital information from the heart monitor is being sent live to the hospital to speed up treatment when Michael arrives. Meanwhile, back at the aquatic centre, Taz is now packing up the ambulance and processing what's just happened.
These 6 leads can open the secrets of your heart. A dying heart. As you know, life is very precious. I think at some stage you start to feel a little bit emotional and a bit proud also. Thinking inside that, thank God I'm a paramedic. Thank God I'm a paramedic because today, I think I saved a life.
By the time the Micah ambulance arrives at the Austin Hospital, Michael has made a remarkable recovery.
We got you here nice and fast.
It's a really good feeling at the end of the day to be able to go, you know, I've just done a 14-hour day, it's been long, it's been a horrible day, but I've just saved someone's life. It's pretty special.
Michael will now be admitted into the cardiac unit to ensure he's out of danger and determine if surgery is required.
You were going to go where next week?
Next, the bush.
The bush. You still might, as long as it's nice and relaxing.
We're not too far now, okay?
Okay.
Jamie and Mike are on their way to the Royal Melbourne Hospital with chronic drinker Rudy.
The only one thing that I eat is a lot of pork.
It's not bad. I like pork.
You know, I fry it.
Oh, yeah?
Beautiful.
Yeah.
I put chili.
You know what? Next time you call an ambulance, you should cook some up. How does that sound?
That sounds good.
Yeah, it does sound good, doesn't it?
After plenty of laughs,
oh, Rudy.
I am happy. Always happy.
Always happy.
the mood suddenly changes.
No, sometimes I'm sad, mate.
Sometimes? Why you get sad for?
When I think about my kids.
Yeah. How many kids have you got, Rudy?
3.
3. Do you see them often?
I don't want to see them because the more I see them, I miss them.
Oh. As fun as Rudy is and having a laugh in the ambulance, you know, he obviously is quite sad at his life situation. When was the last time you had something to eat?
I eat chocolate, mate.
Eat chocolate. When was the last time you had a good sleep, Rudy?
4 days ago.
Why haven't you been sleeping?
I can't sleep, mate.
Is that why you drink? I tend not to look at people in a bad way. These people don't choose that life. Like, sometimes they've just had a wrong choice or a wrong decision or just something bad's gone on in their life and they've just spiraled out of control. How long you been drinking for? A couple of years?
More.
More?
If I want to stop it.
Ah, okay. They've got no one that loves them, they've got no one to care. So I think these people are the ones that need the most sort of reassurance, and even just a touch of the hand and say, you know, everything's going to be okay, we'll take you up to hospital, is enough for them to sort of change their whole outlook and potentially bring them back up. Howdy. Where are the sunnies? You gotta pop them on.
Rudy.
No, mate.
You look sexy.
It's too dark, mate.
It's too dark.
Too dark. We'll find you some well-lit rooms.
We arrived at the hospital and we'd actually gotten to know a lot about Rudy in the kind of short transport time. He was just actually a lovely bloke who'd had a lot to drink.
He was a big fan of you, that bloke.
Ah, I love drunk people like that. They're just so pleasant. You can just have a chat with them, have a laugh. Like, as long as they're pleasant and they're okay, like, I don't mind. Just, you know, sometimes their life's pretty rough and they just need somebody to care about them. And
Happy to help anyone that wants to help themselves.
Every night, more than 200 ambulance crews respond to distress calls throughout Melbourne. Some of those jobs will be critical. Others will just need a helping hand.
Received and thanks.
For paramedics Nat and Leonard, their next assignment is coming to the rescue of an 85-year-old lady who has fallen off her chair and can't get up.
Nancy, is it?
Yeah.
Nancy's daughter Lynette tried everything to get her mum off the floor.
Yeah, I got my neighbour to come and help me because I thought we'd be able to get her up. We tried every way. We got her halfway onto the couch, but we couldn't get her up. So I said, oh, I'm going to have to ring and get them to come out.
Even a non-emergency patient transport crew has struggled to solve the problem.
Nancy, how did you end up on the floor?
I
tried to get up off the chair.
Right.
And I slipped.
Slipped just down, did you?
Yeah. I went down.
Yes. Didn't hurt yourself, did you?
No.
Okay. It must be really hard getting to a point in life where you can't do the things you've been used to doing, where you can't easily get yourself up off the ground.
In their attempt to lift Nancy and avoid injuring their backs, Nat and Leonard are going to deploy their secret weapon.
So what we'll do, Nancy, it's a bit complicated. We're going to put this slide sheet underneath your bottom. So there's going to be a couple of things going under your legs, one going around your back, and then we're going to slide you. It all seems a bit much, but we'll talk you through it one by one.
We have this handy little device called the Elk. It's a lifting cushion. It is amazing. It has changed our lives and saved our backs. We love the Elk. Am I hurting you, Nancy?
No,
You're okay there, love?
A bit of a massage there, but...
I think it's very embarrassing to tell a patient like Nancy, hey, we're just going to lift your buttocks and put this weird machine called the Elk underneath.
Look at that.
I think that's perfect. All right, everyone happy to start going up level 1?
Once we plug the machine in, it starts to make a brrrr noise. And the look on Nancy's face when the machine started to fart and lift her up, I don't think she knew if it was the machine or if it was her.
Oh. Beautiful.
Yeah, I was watching the footy.
Yeah.
Who won?
Hollywood?
Oh, you're not a Collingwood supporter, are you?
No.
No, North Melbourne, that's all right. I don't have to leave now.
Now, do you feel comfortable standing up?
I'm tired.
Okay.
Well done. There we go.
How do you feel?
All right.
Do you feel wobbly or you feel like your normal
No,
self?
I'm all right.
Don't run. Don't run. Okay?
I want to know where you're going to go.
Anywhere.
She just wants to walk.
Away.
To run.
Away from us. I've been to many jobs over the years where elderly people just have no one to call. So it was so lovely to see Nancy's daughter Lynette on scene and know that she was looking after her mum.
All right.
We're done?
We'll get out of here then.
Happy?
Let you be.
Brilliant.
No worries.
Thank you.
Thanks, mate. No worries.
Thank
No
you. You're
worries.
so
Thank you.
welcome.
See you later.
For doing that. Great outcome. Mum's happy, I'm happy. And thank you to the ambulance for coming in and helping Mum.
Well done, Leo.
Yeah.
Good job.
It was a nice job.
Excellent. This job is certainly not all heroics, action, lives being saved. Everyone's version of an emergency is different. So as long as we're there when they're going through a tough time, then we're doing our job. How good was the mango elk for that job? Because it means that we're not lifting.
Well, as they say, you've only got one back.
Who says that?
I don't know. I just made that up.
They say?
I was kind of hoping you'd kind of go
I'd
on
know.
from there. Yeah. inferring that don't screw it up.
Your back?
Because when you do, you don't get your back back.
You don't get your back back? Yeah.
We just got a job, a stabbing.
I received a stab wound during a burglary at code 2.
Received code 2.
It's a new day for Taz and Amanda, and they're already on their way to a home invasion victim.
So this could either be like blood spurting out everywhere.
Or the bandit job.
I'm going for blood.
And
Yep.
We won't be having a Kill Bill Volume 3.
Kill Bill Volume 3.
Paramedic black humour, we call it. It's a bit of just coping mechanism, a bit of self-preservation.
Let's go.
Yeah.
The stabbing victim has managed to get himself to his local police station.
My name's Amanda and this is Taz. What's happened?
When the team arrive, they find 35-year-old Sri Lankan refugee Ganesh bleeding from multiple stab wounds to his hands.
What was it cut with? Metal, glass?
Knife.
A knife, a knife,
yeah,
okay.
Ganesh was on a day off from his job packing mushrooms when an intruder entered his home.
I saw him. Yeah. Then he coming and fighting with me.
Ah, okay. And he had a knife.
He took my mobile, everything.
He had a knife?
Yeah.
Okay.
And you've
Then
put
I
your
tried to take that knife.
Yeah.
you've put your hands out to try and grab the knife, and that's what's happened. Okay.
Despite attempts to take on his assailant, the thief still got away with Ganesh's phone and car.
You're very lucky that he just got your hands, huh? With a knife.
How lucky are you that you haven't lost a finger, you haven't sustained a worse injury, you know, in the arm, in the chest, in the hip?
So the cut itself, Taz, is actually quite clean.
It must be from a sharp knife?
Yeah. We're going to need stitches at the very least.
We can't do anything for them. See? You can arrest him.
We can't. We're the ambulance.
We're the paramedics, Ganesh.
We can't arrest anyone. Now, we need to go to the hospital, okay?
It remains to be seen if there's any permanent damage to Ganesh's hands. With his ability to earn an income in doubt and no family in Australia to support him, Ganesh's dream of getting residency has suffered a major setback.
Although Ganesh's injuries weren't life-threatening, they're definitely life-impacting. In order for him to be here, he needs to work. So these injuries that he's sustained could actually jeopardise him being in Australia at all.
Emergency services. My daughter's nothing in it.
Okay, tell me exactly what happened. She's not breathing, is that right?
Yeah, I noticed vomiting. I just went in there. She's breathing really funny.
A frantic mum has rung emergency services after finding her 2-year-old daughter unconscious.
We'll get some help organised, so just take a deep breath.
The Melbourne-based air ambulance is being dispatched to the caller's location, 190 kilometres away in the Victorian country town of Shepparton.
She's not awake. Her teeth are like closed shut. Okay, is she breathing? She's slightly breathing. Can you please hurry up? So, ma'am, we are getting some help organised for her.
Micah flight paramedic Matt and his crew are on board.
Not 100% clear on what's actually happened at this stage with regards to how the child's become unwell. A crew on scene, they're actually already gone ahead and given the child some drugs and put them in an induced coma and put them to sleep and put a tube down the throat to support their breathing. You know, the ultimate place for this child to be at, rather than being at a rural hospital, is to go down to the Royal Children's Hospital.
Helicopters are called out for life-threatening emergencies that can't be dealt with at local hospitals, with crews responding to more than 2,000 each year.
The work that we actually do is considered to be the sickest of the sick patients. When you get dispatched to a paediatric case, there's always things that go through your mind thinking, oh, is this similar to the age of my children? And, you know, what if this was my children as you get dispatched to it? So it automatically increases your heart rate and your anxiety about the job that you're about to go to.
After 30 minutes, the helicopter arrives at Shepparton Airport. The local paramedics are already on the tarmac, standing by for the Micah helicopter team to arrive.
Hey mate, how you going, all right? That's the way.
Inside the ambulance, 2-year-old Mackenzie is now in an induced coma, with the paramedics controlling her breathing.
So Mackenzie has been well, no problems up till this morning. Mum's found her, she's had vomit over her mouth, over a pillow next to her and breathing funny. So she's done about 5 compressions of CPR or so.
Sure.
And we've arrived, she's got a pulse.
Righto.
Mackenzie's distressed parents and family friends are standing by, helpless. For Mackenzie's mum, Bree, this morning there were no signs of the nightmare ahead.
Went off to playgroup. She had a great morning, and then we came back and she had lunch, and then it was just a kiss goodnight and she went to bed. Then, as I normally do, I always go in and check on her. I noticed that she was doing this really strange breathing. I went closer and then there was vomit over her pillow. And she was all floppy and I was just like saying, come on, wake up, wake up. And yeah, she wasn't waking up. Petrified. Petrified that, you know, the worst was going to happen.
We've sucked her airway out a couple of times now and she's got a pretty good airway, but I've had to really keep the ventilation up to her just to bring her end tidal down.
She's got blood pressure, GCS 4, cerebral posturing, with eyes deviated to 10 o'clock, rolled to the right, but no seizure activity.
And there's been no stiffness other than the decerebrate posturing.
Absolutely.
The guys at scene mentioned decerebrate posturing, which indicates that there's a bit of pressure onto the brain or the brain isn't functioning in the way that it normally should. So if we can just start transferring to our monitor, and that's it, just a little bit of elevation there, it makes us concerned that maybe there is a lack of oxygen to the brain or there's a bleed in the brain. So it heightens our concern about what's going on with the patient. Depending on the degrees of bleeding that people can have in the brain, people can have a very bad outcome from that, and obviously it can lead to death.
Officers in Epping are trying to piece together the moments leading to a man turning up at the police station with a stab wound. The victim in his 30s arrived with a wound to his hand. Paramedics were called, and it's unclear if anyone's been arrested.
How long have you been in Australia for?
5 years.
5 years.
Sri Lankan refugee Ganesh has made news bulletins in the country he now wants to call home.
So you're in the process of getting your visa for Australia, permanent residency for here, and then you can go back to visit. So you haven't been back in 5 years to visit?
No.
Wow. Mum and Dad are also overseas? Yeah. Wow. Do you miss them?
Yeah.
Yeah. Do you like it in Australia, other than what's happened today?
Yeah, nice country.
You poor thing.
Ganesh will soon find out just how serious the damage is to his hands. If he can't get back to work packing mushrooms soon, he may not be able to stay in Australia.
You feel for somebody in his situation, you know, such an innocent soul who's come here to try and change his life for the better. And he's just gone through this horrific event, which would be traumatic for anybody.
We're coming into the hospital now, Ganesh. My heart hurts. I feel bad for you. Come on, Ganesh Warren.
Let's get you sorted, yeah? Let's get your hand fixed.
He just has so many things going against him already. You know, he's left all of his support network behind.
Come, please.
And to have something like this happen to him in his own home, he just doesn't need it.
From immigrant point of view, when we're getting prepared to come to Australia, we are always told that it's a beautiful, safe country.
Come to Australia. We've got such a beautiful, multicultural country. It's really safe, and you'll live a beautiful life there. Sandy beaches, beautiful reef, and then you get burgled and almost lose your fingers.
It's not a perfect world, Amanda.
It's not a perfect world, and this job definitely opens your eyes to that, doesn't it?
It does.
Things that really get to me are those things that make you challenge humanity and realise that, hang on a second, the world's not as good as places you think it is. My heart is aching for that poor boy.
Being a casual worker, you know, and his hand will be, you know, heavily stitched, he won't be able to work for next few days.
Absolutely.
That's his wages gone.
I don't reckon he'll be able to work for at least 2 weeks. And that's if there's no, further damage. Yeah.
Let's get young Mackenzie out of the truck here onto our stretcher.
A flight team are preparing to airlift 2-year-old Mackenzie from country Victoria to Melbourne after she was found unconscious at her home.
1, 2, 3.
The cause is still unknown. Mackenzie's dad, Dean, was at work when he received the news from his wife, Bree.
Bree's call, I wasn't even going to answer the phone. Something made me just answer it, and then just pure panic.
So she's not breathing for herself at the moment. We've got control of all of that, and her heart rate and blood pressure's all good at the moment.
Okay.
In my guts, I just felt sick. Walking around the house as I'm working on it, and I was looking at where she does paintings and on her little table, and she's got like her little crayons and all that, and I'm like, how am I ever going to come back to this house to see this if she's not going to be with us?
It's Mum Bree who'll fly with her only child to the Royal Children's Hospital.
It'll be about a 30-minute trip back to the Royal Children's.
It was extremely hard to let your girl be just taken away from you, out of your sight. I knew she was alive, I knew she had a heartbeat, but I didn't know if that was going to continue. It's like I gave her like a goodbye kiss in the helicopter to never be seen again. So.
Taxi forklift.
Yeah, it just breaks your heart.
Beautiful afternoon out there, isn't it?
Like a fluffy ocean.
Yeah, very much so.
As the heart-wrenching journey to Melbourne gets underway, paramedic Matt attempts to reassure Bree.
Everything is working okay, heart-wise, oxygen-wise, and all those sorts of things. It sounds like she's had a seizure of some sort and has vomited, but that would be my interpretation.
A lot of children have seizures, and they can have seizures for many different types of reasons. When someone has a seizure, they've got disorganised electrical activity going on in their brain, so we try and give them medicine which will sedate them and calm them down.
They'll do a CT scan of the head and work out that everything's going on okay there.
There's lots of other things that it could potentially be, but I'm hoping that it is a seizure activity that's going to resolve and Mackenzie's going to come out of this okay.
She's never been in a helicopter before, so she doesn't get to appreciate it. Oh, well, you'll be able to tell her all about it afterwards. Thanks,
Mackenzie is just a joy. She's our world. I was just thinking, we can't be losing her.
She's got the painted nails and everything.
Yeah, we painted them this morning.
Nice. I've got 3 young kids as well. And, you know, when you look after young kids that are a similar age going through nasty accidents, you just manage looking after the patient at the time. But it's not until you walk away that you actually think about things after. It hits home.
Kids are the worst. I hate seeing kids injured in accidents. Anything that involves children getting hurt is probably the ones that I come home and get upset about. So they're the hard ones to deal with.
Just looking at her with the tubes in her mouth, my mind was racing of all the things that could happen and what's her future going to be like if there's a future. Yeah, I wasn't too sure what the outcome was going to be.
It's a sigh of relief as we actually land at the Royal Children's Hospital. You'd just love to give a reassurance to say everything's going to be all right. But I can't give that 100% guarantee that everything is going to be okay. I think given that sort of circumstance, I will be a blubbering mess. It's not something any parent should really have to go through in their lifetime.
Oh, hi, Michael.
Hello.
You look so well.
Here's my champion. I need a hug. My lifesaver.
It's only been 3 days since Amanda and Taz saved Michael's life after he suffered a near-fatal heart attack.
Taz? You're buddy for life.
Yeah, we are.
Yeah.
Michael has been administered blood thinners to unblock a clogged artery to his heart and is now on the road to recovery.
Look what we found. Being able to meet Michael was a really, really special moment for me.
I actually, when you told me it's a heart attack, I started to reason with him up there. I said, I don't think it's my time yet. I've got a few more things to do.
Yep. Well, he agreed because you're here. Yeah. I've only been in the job for a short period of time, but it really made me realise I love what I do. It's really humbling. It makes you realise that the world and the universe is bigger than you, but no matter how small you are, every little person can make a difference.
I can't thank you guys anymore.
You don't need to. You know, that's our job. Now, what we did, anyone would have been in the same situation would have done the same.
You guys are very, very special.
To be honest, people like you give us the inspiration to keep going.
Yeah.
I'm so happy to hear that.
Yeah. I definitely felt proud to see breathing Michael. Because of this blue uniform, someone is actually thanking me for saving their life. And that's why if you ask my daughter, what's your daddy's favorite color? And she'll say blue. And I love to be paramedic.
It's good news as well for Taz and Amanda's other case, Sri Lankan refugee Ganesh, who was stabbed in his home. After requiring stitches for severe lacerations, his hands have now healed completely, allowing Ganesh to return to his mushroom packing job and stay in Australia. So far, police have not been able to track down his attacker. And it's been 1 week since 2-year-old Mackenzie was found unconscious and airlifted to hospital.
The last time I saw Mackenzie was as I handed her over to the hospital staff at the Royal Children's Hospital. This is one of the cases that I want to know that she has a positive outcome. I want to hear that everything's okay.
1, 2, 3.
Yay! The doctors told us that it was a possible seizure, what had happened, but there was no injury to the brain. Her chest scan was clear. All her bloods had come back normal. So it was positive in that way, but then it was also, well, why did this happen? And will it ever happen again?
Hello, Mackenzie. How are you? Do you remember me? I guess you don't remember me at all. I've got a little surprise for you. Oh, wow. That's a big teddy.
While Mackenzie's been cleared of epilepsy, what doctors can't tell Bree is whether her little girl will suffer any more seizures.
Can I have a hug, please? Oh, thank you.
Now that we're back home, we've become these like helicopter parents. I crept in on her the other day when she was having her day nap and I must have made a noise and she kind of looks at me and she's like, Mum, what are you doing? And I was like, no, it's fine. You're fine. It's all good. Go back to sleep.
Oh, and another step.
Today, Matt's going to get Mackenzie airborne again. And this time, she'll remember the trip.
Now, if you look over there, behind that crane is the Royal Children's Hospital, and that's where we flew you to in the helicopter.
The paramedics were fantastic. By far the worst moment I've ever been through, but surrounded by the greatest people that we've had the pleasure of meeting.
We're just, forever thankful. So thank you so much.
The work they do and how they do it is just mind-blowing. It takes a special breed of person to do what they do. We owe our daughter's lifetime.
Out of the way, mate.
5:30, thank you. It's a Paraglider incident that's hit the ground. Pretty back injuries.
Mobile intensive care ambulance paramedics Mark and Karina are responding to a code 1. A novice paraglider has crashed into an isolated cliff face on the Mornington Peninsula, south of Melbourne.
Patient fell approximately 20 metres. Patient injured back, nil further info at this stage.
Right.
A major incident like this in such a remote location needs the big guns. So the air ambulance has also been called in.
Any job where you get to beat the helicopter or try and beat the helicopter is a good job in itself.
You better drive it like you stole it, dude.
So this guy's seriously lucky to be alive, and our biggest priority is to get there as quickly as possible to work out what sort of injuries he's got, knowing that from a 20-metre fall from a paraglider, they could be life-threatening.
As Micah paramedics with 27 years of shared experience, Mark and Karina know situations like this are fraught with danger.
We have to walk some 500 metres across the sand to reach this man that I can see perched about halfway up the cliff. How are we going to get him down safely before the light starts to fade?
All available emergency rescue crews have been rushed to the scene. The man who fell out of the sky, 60-year-old Sid, is in a critical condition.
So I lay eyes on Sid for the first time and I think, you are in serious trouble, mate. You are pale, I can see that you're sweaty, you're in enormous amounts of pain. We need to get you off this cliff as soon as possible. This scene is so dangerous. He's in a precarious position and we know that one wrong move getting him down that cliff face could change his life forever.
Out in Melbourne's northern suburbs, it's becoming a busy night.
This is a really good job. I'm amazed that we're the closest, but I'm not complaining at all. Rightio.
We're going to make sure we get close enough so they don't find another car.
Paramedics Nat and Leonard are racing to get to a Code 1, almost 16 kilometres away.
We get so excited about the big jobs, not because we want people to be in those horrendous car accidents or major trauma, but when you think about the action, the lights and sirens, we want to hunt those jobs. We want to be there for the big one. That's what we do the job for, to truly help people when it's a life or death situation.
Oh my God. They're not going to move over. They don't understand. They're just going to accelerate to where? And it's a P-plater.
Jeez.
Just be careful.
But before the team can break through the traffic...
Why is there another unit?
701 for a camp.
No! No!
Damn it!
No!
An ambulance closer to the location is assigned to the job.
Oh, no!
Don't get me wrong, I don't want people to be unwell. But if you are critically unwell, if you do need to be saved, then I want it to be my ambulance that gets to you. I want to be the one that gets there. I want to make the difference.
NRC 701 received.
Within minutes, another job comes through, but it's not on the top of their wish list.
Oh, taking ice. Great. Great. That's what we want to go to.
You're 63. Received and thanks. I think if you're 63 and using ice...
There's going to be something wrong.
There's something wrong.
Yeah, acknowledge when you can we get a detailed sit rep to pass on to control, please. Thanks.
On the Mornington Peninsula, emergency services are under pressure to get 60-year-old Sid off the cliff and to a trauma hospital. It's been hours since the paraglider crashed and the temperature is dropping rapidly.
I look at Sid and I'm really worried about him. I'm really worried about how long he's been up on that cliff and how long it's going to take for us to safely get him down. It is freezing cold, the temperature is plummeting, hypothermia is probably setting in, and that is the last thing that Sid needs with his injuries.
The biggest concern is whether Sid has done irreversible damage to his spine. The huge team of emergency services must move quickly to get him off the steep cliff face, but with the greatest of care.
I can see the sort of terrain he's fallen into, nothing's flat, there's edges sticking out. And I just think the potential for disaster is everywhere.
Stand by, Golf Control.
My two biggest fears with this guy is that he'll either have a head injury or he'll have a spinal injury. One wrong move and potentially we could put this gentleman in a wheelchair for the rest of his life.
For Sid, it's a frightening possibility.
I couldn't feel my legs. I couldn't breathe. 3 times I almost lost consciousness. Once I couldn't hear them. Twice I went blind, and I was feeling incredibly sick, and I was cold. I thought, I've really done it now. You know, I'll be lucky to survive this, let alone walk again. It was terrifying.
RC701, we've arrived.
Nat and Leonard are attending a drug-related call from a 63-year-old in an outer suburb of Melbourne. The pair are on high alert, uncertain of how dangerous the situation they're entering may be.
Hello? Ambulance. Where am I going?
When we go to patients affected by ice, the number one thing we don't like is violence.
Is it just you here? No one else?
No one else. These patients can be extremely unpredictable, and methamphetamine, or ice as we know it, completely amps them up to a level that sometimes we can't control.
Hello, do you mind if we turn on the light?
No, not at all, please do.
Hi there.
Hi there.
What is your name, sir?
My name is Ron.
Tell me, Ron, why have you called an ambulance tonight?
I have 2 hip transplants.
Hip replacements?
Hip replacements, yes.
Okay.
And I'm in chronic pain with them.
Yes.
The pain was so bad, some fools suggested that I have this stuff that will take the pain away.
Okay. So what have you used tonight, Ron?
They said it was ice.
And what are you feeling at the moment, Ron? Okay. Did you inject it or did you smoke it?
Injected.
Injected.
Yes.
Okay.
They
and
said
what
it
time?
was the quickest way to stop the pain.
What time did you inject it, Ron?
Idiots.
What time?
Maybe 40 minutes ago.
Okay. And straight after that, you felt your heart beating. Is that right?
Palpitation.
And are they still going?
Still going, yeah.
Pain, discomfort.
No, there's no pain.
No pain.
Just panic.
Panic. Okay.
You could feel the rush go through.
Yes.
And my head sort of on fire.
So ice will do that to you?
Well, I don't know because I don't take the blood.
Yeah, it's methamphetamine. So it speeds everything up. Your heart rate, increase your blood pressure, can increase your temperature.
We'll get your temperature up. We're going to talk about that.
That is how it works.
My head was going to blow off.
Potentially.
Nat and Leonard perform an ECG test on Ron to make sure he's not having a heart attack.
Okay, looking good.
The result isn't all clear, but Ron is still in a bad way.
So Ron's trying to tell us he doesn't understand why injecting ice is not going to cure his pain. All it's doing is speeding up my heart rate.
I'm just freaking out.
Yeah.
Stuff might kill me.
And I'm thinking, yeah, that's what ice normally does. It speeds your heart rate up and makes you freak out.
Doing really well there, mate.
On the Mornington Peninsula, fears are growing for 60-year-old paraglider Sid after he crashed into a cliff face, sustaining critical injuries. Emergency service crews are preparing to move Sid, with Micah paramedics Karina and Mark unsure if he'll ever walk again.
Where's the stemmatil? How about I just take an ampoule of each?
Get him down off the side of the hill is a nightmare. The massive potential for injury here, for internal injury, for spinal injury, for neck injuries, head injuries, enormous.
Once he's in and strapped in, he won't be going anywhere.
Oh, it's just getting him across, mate. Like, if I try and move him across now, he's going to go...
Yeah. These guys will get that rescue line there. Yep. We'll bring that down, connect that into the system there.
Beautiful.
With ropes secured at the top of the cliff, the emergency crews are now ready for the tricky descent.
You guys right?
Yep. Happy Cratchy. Coming up.
It's been a monumental effort that's taken 3 hours just to get to this point.
So we'll just load the stretcher in so it can slide it down. So you guys ready down the bottom? I'll get you in position.
We've got a concept called the golden hour, which really means that someone like Sid really needs to be at a hospital within an hour of the incident.
How we look at it? Yeah, they're good to go. Are we going to go?
But on the flip side, we know that we need to be so incredibly cautious of how we get him down. We're working on the worst case scenario of him having a spinal injury.
Good, that's it, boys. Nice and easy. Walk down, just watch you stepping behind you there. It just drops off.
So I'm watching them move Sid down this cliff face, just inch by inch.
That's it, yeah, that's it.
One wrong move could end in tragedy, and he could end up as a paraplegic and never walk again.
Just put in. Easy.
To stand there and watch it happen, you just breathe in and hold your breath for the entire time.
And now down. Yep, beautiful.
For Sid, it's felt like an eternity.
Thank God they're lifting me down. Thank God we're moving.
Okay, so we got a few bumps ups and downs.
It was dangerous for them. It was dangerous for me. They did everything perfectly. But the pain and the breathing was difficult, and I couldn't feel my legs. It was terrifying.
Sid is now transported up to the waiting helicopter to be flown to trauma specialists at the Royal Melbourne Hospital.
How do you feel as far as pain goes?
It's okay.
It's okay at the moment? Okay, so you send yourself off cliffs because...
It's supposed to be fun.
Right, right.
So we've taken every precaution at this point to get Sid safely into the back of the helicopter.
Ready, set, go.
But he's got significant injuries. I hope that this doesn't change the rest of his life.
Sometimes in your heart of hearts, you know when a case is going to have a good outcome. We've done everything we can for him, but I just don't know.
I made a deal with the universe. I said, if you get me out of this situation and just let me walk again, I won't fly. I will never fly again.
Everything's looking okay. You don't have palpitations at the moment.
63-year-old Ron has taken what he thinks is the drug ice for pain relief, following hip replacement surgery. He's passed Nat and Leonard's ECG test, but Ron is still worried.
I can't tell you what was in the drug that you took, and I can't tell you what it will cause later on.
That's the thing, Ron. You don't know about the quality control of what's made in a backyard. Might not be pure amphetamine or methamphetamine.
See, what they said was that it would kill the pain. It hasn't killed the bloody pain at all. It's just sent me into...
Well, there you go. They've already got one thing wrong. And now they're telling you it's ice. It might not even be that. So as long as you're comfortable knowing that it might not be what you think you took. Do you understand that?
Yes, I do, young man. Yes, thank you very, very much.
Ron could definitely be the new poster boy for the anti-ice campaign about why you shouldn't be taking things that are made in the backyard when you don't know what they are.
My advice is to come to an emergency department where you can be monitored.
I don't want to take somebody's bed up that's dying of something, some poor old lady.
I don't think they would put you in a bed.
Idiotic behaviour.
Yeah, no, I don't think you need to worry about that.
I just freaked out. I thought I was going to die because I took that shit that someone said that would ease my pain, and it's ice.
So you're not going to use this stuff again, are you?
Oh, never, 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 never. My God, strike me down, never again.
Good.
Ron's passed on a trip to hospital for a checkup, but he has called his mate Steve to come and look after him.
And Steve knows he can call us back if anything changes, okay?
Absolutely.
All the best.
Oh, God bless you.
You take care, okay?
Love you so much.
Take care, mate.
Thank you so much.
Ron is very unlike most other patients who take ice. He was courteous, he was friendly, and he was remorseful. I don't think I've ever said that about another patient on ice, ever.
We're just glad you're okay.
Thank you very much.
Look after yourself, okay?
And you won't have to ever visit me again because I'll never go near that stuff as long as I live.
Great. Okay, I'm going to just let them know. I'm going to start writing Bacchus.
For God's sake, anybody that's out there, don't take that. It's going to, if not kill you, ruin your life. I don't understand how people can be addicted to something like that. It's bizarre.
Well, he was a colourful man.
Oh, my God. What a man, huh?
For someone who's taken ice, is kind of one of the nicest people I've met on ice.
That's true. Top bloke.
Did you have dinner with him?
I've got his number.
Well done, Nat. It's been a long night, but you're still up for a laugh.
Do you want to stop at Club X?
Well, I'm not really the
Club
adventurous type, no.
Oh, really?
Yeah, I'm pretty vanilla.
Oh,
when it
boring.
comes to that kind of stuff, yeah.
Oh, boring.
I hope he looks like a deer in headlights.
It's the early morning shift, and Jamie's partner, Mike, is nowhere to be seen.
Hey, nice of you to show up, mate.
I'm
What's taking so long? You're an hour late, mate.
Oh,
What's
come
going
on.
on?
50, that's an hour. 51 minutes.
If you're going to rock up late, you're making me single respond for an hour because we obviously can't go out of service just because someone's late. We still respond by ourselves. You are doing everything today. No way he was going to get off that lightly at all.
Just be thankful I put pants on before I got in the car.
Did you woken up by the call?
Yeah, that's why Matt probably heard the terror in my voice. Myself, I hate being late. There's nothing worse than being late.
You know, you got to let the duty managers know that your partner's running late, and he was getting in on it.
Just a reason for the late login?
701, that was, I slept in.
It was good that he rocked up late, though, because I'd forgotten to bring my lunch that day, so, you know, punishment for turning up late, you got to buy me lunch.
Roger, thank you. I hate being late, and I tried really hard not to do it, but yeah, it kind of wrecks your day. You happy there, mate?
24 nuggets, amazing, when they're free.
Fortunately for Mike, he's arrived just in time.
Emergency services?
The car's just run into a cyclist. She's just lying on the road.
Okay, let's get some help. Is she awake?
Yes.
Is she breathing?
Yes. She's a bit in shock.
We'll keep her absolutely still at this stage.
Stay still at this stage, please.
Because she may not know the extent of her injuries as well, okay?
Car versus cyclist is usually pretty nasty, hey? Yeah, well, she could have anything going on.
A car and a bike have collided. It's a scenario that paramedics see all too often.
Definitely worry about fractures and helmet status, whether she's wearing it or not. Hopefully she is.
Obviously, with the force of the car versus such a small object, the damage is usually going to be pretty bad.
With the police still on their way, Mike and Jamie are first on the scene.
Hello. How you going? What's your name? Saba. G'day, Saba. I'm Jamie. I've got Michael with me.
Mike's parked the ambulance across the street to block off traffic, keeping the patient safe.
What's happened, Saba?
So I just hit the side of a car. So it's this side here.
Yep.
My hip's a little bit bruised.
Okay.
But it's mostly my shoulder, which is
A bit sore, is it?
Yeah.
Yeah, right.
I'm finding it hard to get up.
Yeah, okay. Have you hit your head at all?
No.
No, beautiful.
The distraught driver who collided with Saba has not left her side.
As I'm treating Saba on the road, I've looked up and there's this lady in hysterics, and I'm thinking to myself, who's this lady? What's going on? She was more distressed than Saba was.
Now, with your hips, which hip is it? This right one? Yeah, okay. Does it hurt on this side? Is that a bit painful there? Yeah.
Before taking off Saba's helmet or moving her, Jamie must first carry out a full assessment to see if Saba has sustained any spinal injuries.
With trauma cases, the adrenaline's so high, usually it masks pain, especially in car accidents and road traffic accidents.
And apart from the shoulder pain and the hip pain, any pain anywhere else?
No.
No. She's trying to say, no, I'm fine. But she could have all these injuries that we know nothing about that she probably isn't aware of.
Whenever a car hits anyone, regardless of speed, that's significant force. That's metal versus bone and flesh. So we've got to check her out before we let her move anywhere, because the last thing we want to do is make anything worse.
So I got up at 4:30 this morning.
That's ridiculous. What time did you leave home? 5:30?
5:35 I left.
The day shift has just started for new partners, Taz and rookie Amanda. They're still getting to know each other.
And my wife got up at 5 and she started making chais and packing my, few lunch for me. And,
that's nice.
Oh, that's what they do. She's wife. That's her job.
I am dumbfounded, but I'm going to let it go. Good girl.
Even though I make jokes, my wife completes me. And she's my soulmate. All my friends, they ask for chai tea because they don't know the difference between chai and tea.
19 years ago, Taz made the huge decision to leave his parents and friends in India for a new life in Australia.
Chai is tea and tea is chai.
After working at a series of jobs, including scrubbing toilets so he could finish his paramedics training, Taz was ready to start a family the traditional way. An arranged marriage with Pretty.
When I got married and realised that, we are made for each other. And she's a beautiful girl and she's definitely my better half. We've got a couple of beautiful kids and my world revolves around them. I'm gonna get you this time! They're perfect. I don't know why he swallowed that. Choop.
He is so cool because he's a paramedic and he helps people.
Swallowed the
And I think he is like a superhero, but he don't have a cape, so how could he be a superhero?
What do you reckon?
It's a good thing Taz now has that cape.
Come on, move over.
Because he and Amanda are needed urgently. A man has suddenly collapsed at a shop fitting factory. The paramedics find the owner, 45-year-old Con, unable to move and in excruciating pain.
What's happening? Is it spasming, is it?
Yes, it's not releasing.
So what were you doing when it locked up? Just walking. Con is groaning and moaning and sweating and everyone around is very, very concerned that there's something more serious going on.
Just
Con,
keep talking, I'll be taking your blood pressure.
You're safe and we're going to get some pain relief on board in a minute, okay? Have you ever had the green whistle before? No. You haven't? We rarely give the green whistle as a first-line treatment, but in this case, it was the most appropriate. What I need you to do, this only works when you use it, okay? We're going to use this just to move you towards the ambulance, okay? The solution inside the green whistle is known as methoxyfluorine, and it's actually a low-concentration anaesthetic. So finger on the hole.
Yep.
Put it in your mouth. In through your mouth and out through your nose. That's it. Are you his wife? Hi, Despina.
I've walked into the work area and I see Con bent over in a funny position in a lot of pain.
Despina popped in to visit her husband at work, along with their 3 kids. But now she quickly leads them away from the traumatic scene.
My greatest fear is he's having a heart attack and I've got my kids there. I didn't want them to see him like that.
Hey, you've got the pain relief in your hand. That's it.
And you got no pain down the back here at all?
No, not on the back.
No.
Cyclist Saba, who collided with a car, is still trying to tell the paramedics she doesn't need to go to hospital.
You just yell out when it hurts, okay? Coming down your arm here.
Getting tight on there. Fine.
That's fine. And your collarbone here?
That's
a bit sore?
A little sore, but it's okay.
Before removing her helmet, Jamie gave Saba a spinal clearance test to make sure there was no spinal damage. The tests must now be repeated before moving her off the road.
While we're here, no pain down here? No. Beautiful, lovely. No pain? No. And definitely, again, no pain here at all? No. Very good. All right. Our next step is to carefully get Saba onto our stretcher and into the ambulance. How are you feeling at the moment?
Fine, yeah.
Oh, beautiful. Okay, just watch your elbows for me, Saba. Coming in.
Even in the back of the ambulance, Saba is insisting her injuries are minor. But Jamie and Mike are still extremely concerned.
Your adrenaline is rushing, so you don't feel pain, you feel super strong, and she thinks that everything's okay. We're very suspicious that she's got some injuries that she probably isn't aware of.
It's just tender.
Just tender? Yeah. Give my hands a big squeeze. Lift them up and give my hands a big squeeze.
But there are also concerns for the driver of the car, who is clearly shaken. It's a dangerous intersection that recently claimed a life.
This is the lady that she's running.
Oh, okay,
She's
yeah.
stressing hard.
I'm fine, thank you.
I gave them my details, so
Fantastic.
contact me if you need
Okay.
anything at all.
Thanks very much.
I'm really sorry. I know that means nothing to you.
No,
I'm really
it does, thank you.
When the driver came over, all I wanted to do was sort of reassure her that I was okay and make her feel a bit better.
Please contact me.
I will do.
Anything,
Thank
anything
you.
at all.
Thank you.
I'll leave you to get.
Thanks. Thank you.
Saba's sitting in the back of the ambulance, and instead of worrying about her own personal safety, she's more concerned about the other driver. So she's probably one of the loveliest ladies I've ever met. So how bad's the pain at the moment out of 10?
It's not too bad.
Not too bad. We'll run you up to hospital though, because obviously you've been in an accident. You need to get seen by a doctor, make sure everything's okay.
Whether or not Saba has sustained any serious injuries won't be known until she's assessed at hospital.
As the adrenaline wears off, you are going to start experiencing more pain, and if I let her go home, you know, who knows what would happen. We don't have X-ray vision, we don't know.
Con,
All right.
do you think you can shuffle to this stretcher?
Can you stand?
Factory owner Con has collapsed with excruciating back pain at his workplace. Now, Taz and Amanda need to get him to hospital for scans to determine the cause and see if there's any permanent damage.
Now, do you want to lie
job.
flat or you want to sit up? Flat, please. Flat, okay.
Good job.
Let me know where to stop.
You're doing really well. Suck on the whistle, suck on the whistle.
Keep using that green whistle, Con. It only works for about 25 to 30 minutes. We'll give you something stronger, okay?
It's estimated the cost of chronic back pain to the Australian economy is $5.7 billion a year. And right now, Con's looking like he could be one of those statistics.
Just keep your hand on my knee. Don't worry, it's not cheating, I promise.
With the effects of the green whistle fading, Taz is following up with some intravenous pain relief.
Okay.
Oh, straight in. Look at that, see? It's what happens when the expert does it. You're doing all right, Con. I know you don't feel like it, but you are.
I do love my husband very much. I couldn't even think of my life without him. Sorry. Sorry. Embarrassing. Sorry.
And this beautiful, lovely lady that's patting your head, how long have we been betrothed?
Which one is it?
Which one is it?
As the pain starts to subside, Con is feeling more like his old self.
The best years of your life, that's for sure. Taz has got an excellent wife too. She cooks, packs him lunch every day, makes him fresh chai in the morning. What a woman.
Because you haven't had kids yet.
Oh, no. Taz, you've got, how many kids have you got, Taz?
Two.
And you still get breakfast in bed. Wow.
That's the definition of true wife.
Two wives.
True. Not two. True.
Taz and Amanda were magnificent. They kept Con and myself calm. They were just brilliant.
Well, he's got his sense of humour back, so he's definitely comfortable.
I'm not sure he ever lost that, to be honest. Cheeky man. Despina was fairly concerned that today was going to be the day that she was going to lose her husband. Not on my watch.
With Con delivered safely to hospital, he'll soon learn the cause of his paralysing pain. If he needs surgery, it could be a long time before he's back running his business. Back at base, and paramedics Nicola and Michelle, better known as Risky, are on the night shift. These two have been working together for 5 years and know each other inside out.
It's my birthday. It's good to be 21 again. 4th year running, 21.
Why are you being quiet?
I don't know.
So Risky and I have developed a birthday tradition over the years. Because she loves chocolate, I bake her chocolate brownies. So this year on her birthday, I thought I would trick her into thinking I'd forgotten all about it. Where to?
Can we stop somewhere because I really need some sugar, please?
Sugar?
Yeah.
Did you think I'd forgotten that it's your birthday? Sugar?
A little bit.
Have a look under that coat there.
Oh, you little ripper! Thanks. Bingo. Here they are. You beauty.
Yeah, last year's batch Risky complained about. She said I'd overcooked them, and I was thinking this is pretty rich given that I get nothing on my birthday, so she should just be grateful for what she gets.
Best batch yet.
They're pretty good if I say so myself.
Pretty damn good. Thank you.
All right, let's get out of here.
Ooh, this is my dinner.
The sugar hit is just what Nicola and Risky need. They've got a long night ahead of them.
Emergency services. Tell me exactly what happened.
I spent the night at a friend's place and I got severely hammered by bedbugs.
As the team head to the bedbugs case, it's upgraded to a Code 1. It appears the victim is now suffering a potentially life-threatening allergic reaction.
I've got welts coming up all over my body. My left eye's all swelling up. I can hardly see out of it.
Righto, how do you know you've got bed bugs? I've never had bed bugs. That's a legitimate question. Honestly, bed bugs, it's already making me feel a bit itchy.
Read this way, Risky.
Oh. Hello.
Hello.
Hi. Do you want to have a seat and we'll have a chat?
Yeah. I've been severely attacked by bedbugs. They get run your hand along that.
Yeah, I can see them. Yeah.
48-year-old Mark is covered in angry red bites and is very itchy.
There are no bedbugs here, as far as I know, but I spent the night at a friend's place.
Okay.
And she was telling me that she's got bedbugs.
Right.
But I didn't jerry on that it could be so severe, but
Mark's clearly itchy with these bites. If he keeps itching them and they become open wounds, they can get infected, which would be one of my concerns for him.
Every time Risky gets close to Mark, I can tell that she's starting to get paranoid about catching bed bugs, and I'm thinking it's better you than me.
They got me good.
Risky and Nicola must now run tests to find out if Mark is in danger of a serious allergic reaction.
I can feel them everywhere. Look at that one.
Yeah, they're going to get bigger.
Are they?
Yeah.
Oh.
There's nothing you know of that you're allergic to?
No.
No.
Risky and Nicola are dealing with a bizarre case of bedbugs.
Got a few on your back as well.
I've got them all over me. Like.
Yeah.
After examining Mark, they've ruled out a life-threatening allergic reaction.
He certainly doesn't appear to be in anaphylaxis. He's got a swollen eye, but that's because one of the bed bugs has bitten his eye. So I think that's what's concerned him most. So Mark doesn't need to go to an emergency department tonight. He doesn't need our services either. However, he does need some lotion for those bites, or he's going to be in a world of hurt tonight. Is there any way that you could get to a pharmacist?
No, I can't. I can't envision that at this time of night.
This is a case that definitely didn't need an ambulance and could have been safely managed by a medical advice hotline.
Oh.
However, Nicola and Risky are now here and take pity on the itchy Mark.
So I turn to Nicola and I'm like, what the hell? Let's just drive him down there. Let's just get this problem sorted.
The team are going to drop Mark off at a pharmacy, which is on their way back to base. However, Risky does have one condition.
How about you change your clothes, just so that you're not walking in with bed bugs? Just a full change, yeah.
Okay, I'll do that.
Now, Risky's a nice person, but
She's not a saint, so I think although it's the nice thing to do is to help Mark get to the pharmacy, I think her motives had more to do with worrying that he was going to call back for an ambulance and we'd have to go back later on.
Just there. Thanks, Mark. So we jump in the back of the ambulance and then Mark tells me that he's a busker, but he plays the spoons. So what do you hit the spoons on, or do they just hit themselves? Oh, okay, yep. So the more and more passionate Mark gets about talking about these spoons, the less and less itchy he gets. It's a pretty good distraction.
They're savage. They've gotten me all over my body, eh?
Are you going back to the same house?
Even the pharmacist has developed a phantom itch.
To me, it's just one straight away. We'll make you drowsy, so...
Thank you very much. Thank you, love.
You're all right.
Above and beyond your call of duty.
That's all right. As soon as Mark's gone, I'm straight into that ambulance and I'm wiping every surface, I'm wiping all the equipment we use, and I'm doing everything I can to make sure that we don't get these bites.
I feel like I'm going to get bed bugs now. So do I. Feel a little itchy, actually. But seriously, my face is a bit itchy.
Oh,
I'm not
it's
joking.
paranoia, though. It'll be itchy, I believe you. It's just paranoia. I'm prepared to give sympathy when sympathy's due, but this is just risky being paranoid and she needs to harden up. Stop scratching. You're just freaking yourself out.
I know.
All right, that's done.
Thanks, love.
45-year-old Con is now recovering at home with his wife Despina after having spent 5 days in hospital. He was treated for 3 dehydrated discs in his back, which caused him to collapse at his factory in excruciating pain.
I think it has been a little wake-up call. I think he realises he needs to look after himself more and not work as hard as he does.
Lucky for Con, he won't need any surgery and will be back at work in a few weeks.
I always look after you.
Yeah, you do.
Yeah.
Look after everyone.
And if it was me, you'd look after me.
Yeah. Despina's probably one of the most caring people I know. Love of my life, a great mum and a great wife. Yeah, like it could have been a lot worse.
Serious? That's right.
Yeah, he'll be right.
That's right.
Let me get back into it now.
Just a week after his run-in with those pesky bugs, Mark is back on the street busking.
Nasty little critters. Ooh, they got me bad.
After a course of antihistamines, Mark is fighting fit and doing what he loves more than anything.
They took me in the ambulance and they took me down to the chemist. You know, I mean, I didn't expect that from the ambulance crew, but yeah, hey, spot on. Okay, I've even got an audience.
As for bicycle accident victim Saba, it was a good thing paramedic Jamie persuaded his patient to go to the emergency department.
At the hospital, I later found out that I'd fractured my collarbone, 7 ribs, pelvis and sacrum.
After 5 days in hospital and weeks of rehab, Saba's well on her way to a full recovery and grateful to be back on her bike.
Poor Saba, she'd actually done a number on herself. Looking back at it, it's good to know that I've actually convinced her to come up to hospital and get checked out because she definitely needed it.
This is a girl that wanted us to kind of let her go to work that day. She said, no, I'm feeling fine. So she was incredibly lucky.
They're one of the most underrated people on this earth. I think they're fantastic. They do a job that not many people could do, and they were just great.
And it's been 2 weeks since novice paraglider Sid crashed into a cliff on the Mornington Peninsula. When paramedic Mark saw Sid airlifted out by chopper, he wasn't sure if the 60-year-old would ever walk again.
Sid, how you going? Can't believe you're up on your feet.
Come in,
it's
please.
amazing.
To fall 20 metres and survive is incredible in itself, but to be up walking again in the next couple of weeks is just miraculous.
Apparently I'd pulverised my lumbar, one of the spine, yeah.
Wow, yeah, well, they wouldn't use that word too lightly, I can imagine.
With a smashed spine, Sid underwent surgery to have a 5-disc lumbar fusion. It's allowed him to walk again.
And believe me, every painful step I've been taking has been fantastic. The surgeon told me that I was in a very, very, very vulnerable, very fragile position. And if you hadn't handled the situation well, I'd be a paraplegic.
Wow.
I mean, this is my life.
Yeah.
The reality is, because you did your job, I can walk.
Yeah.
As a paramedic, I'm always nervous about spinal injuries because I know that they don't always end well. So there's just no better news than knowing that one of our patients is up walking again.
And remember Sid's promise on the side of that cliff that he would never paraglide again if he could still walk? Well, he's keeping the promise.
You don't screw with the universe. Yeah, they came good with the deal, so I've got to keep my side of it. Absolutely. As much as I loved flying, I will never fly again.
So good to see you.
Thank you.
Yeah.
Emergency services.
My daughter's, she's suffering pretty bad from asthma panic attack, and she's gone worse.
It's a busy night at the Emergency Communications Centre as dispatchers receive a desperate appeal for help from Melbourne's outer east.
Okay, is she breathing?
Yes.
Is she still awake then?
She's collapsing.
The caller's daughter is having an asthma attack so severe, she urgently needs help from a mobile intensive care ambulance.
Thanks, Micah 30, backing RC732.
Micah paramedics, Mark and Karina, have specialist training and attend the most life-threatening situations.
She's gone brutal. I'm going to lose her.
Listen carefully, okay? I'm going to tell you how to give mouth to mouth. 2 breaths and 30 pumps. I'm right here with you. Don't give up. Just keep it going until the paramedics arrive.
Another crew has already arrived on the scene and radios through with news.
Patient's pre-arrest. Currently through pre-asthmatic arrest.
Give it adrenaline, kids. Give it adrenaline.
During pre-arrest, a patient's heart can stop beating at any time.
Clear left.
Asthma is such an incredibly dynamic disease. Literally minutes can make the difference between life and death.
Yep, go for it.
So on the way to the job, you start to formulate a plan about the things that we're going to do, the medications that we're going to use, right down to how we're going to get this patient out of the house. Because if we don't get there and intervene very shortly, then she's going to die.
Hey guys, how are you? Mark and Karina?
The situation at the scene is critical. Distraught mum Anna has been watching on as paramedics William and Caitlin battle to keep her daughter breathing.
What's her name?
Kelly.
Kelly, open your eyes for me, darling. Open your eyes for me.
I see that she's unconscious, she's sweaty and she's blue and she's not moving much here at all, and I know that she's knocking on death's door.
Emergency services. Tell me exactly what's happened. Robin has had a fall. Yeah. He was screaming with pain. He said, I'm having a heart attack.
In the city centre, paramedics Nat and Leonard are rushing to the aid of a man with severe chest pains. This could be another case of life and death.
Man, this traffic is out of control.
Isn't it?
It's horrible.
But it's peak hour in the city centre.
Yeah, you clear all lanes.
One.
No, not clear now. She's decided to move. Stay there.
Kidding me?
Far out.
You need to stop.
Stop, mate.
Stop.
We have to be very careful driving in the city at night. People do very unpredictable things.
Is it down the lane?
It's down here, supposedly.
I don't think anything surprises me anymore. People stop right in front of us. People pull out in front of us. It's very dangerous.
Oh, that's number 10. Here we go.
Sheesh.
Okay.
Hello, you're the patient, sir? I'm the patient. You're the patient.
75-year-old Robin has been waiting for paramedics with his neighbour and friend Jay.
When we arrived, Robin's very concerned about this pain he's been experiencing in his chest.
It's got worse.
What's got worse?
The pain.
As a heart attack is suspected, Robin must be assessed quickly.
Tell me about what's happened today or what's been happening
I had a
recently
couple
with
of
you.
collapses when I came out of the bathroom.
What did you hit first? Which part of your body?
This side down here.
Yep. You've landed kind of on that left side.
Correct.
And you've had pain there ever since?
Yes.
Despite 2 major falls, Robin's convinced it's his heart that's in trouble.
Robin called me. Every time he breathed, he was in pain. And he said, Jay, I think I'm dying.
I couldn't move. Every time I moved, there was this staggering pain going through here, which is where I think the heart is.
Very early on, I noticed how stressed Robin is. You can just see it on his face. He's certain that he's going to die.
You're okay, Kelly. You're okay. It's the paramedics.
Back in the outer eastern suburbs, Mark and Karina's patient, 25-year-old Kelly, is in imminent danger. She has suffered a massive asthma attack and is struggling to get air in and out of her lungs.
All right, adrenaline 1 in 1,000, 500 mics.
The Mica crew have administered 4 adrenaline injections in a desperate attempt to kickstart Kelly's breathing. But there's been precious little response.
Kelly, open your eyes for me, darling. Open your eyes for me.
We need to step it up. I need to give her an infusion via a drip in the hope that we can open up her airways and help her to breathe.
So 100 mics per mil. 100 mics, I'll give it. Do you want to? Okay. Sharp set, guys. Really, I mean, unless the adrenaline turns her around profoundly, she's going to need intubation.
I'm acutely aware of what's at stake. Kelly's dying of asthma right in front of us, and I know that unless we do our job effectively and that the next few steps work well for us, it's about as serious as it gets.
Mum Anna knows the situation is dire.
I was saying my prayers, don't take her away from me. If this cannot happen. This cannot happen.
How does it feel to you?
It's very creepy.
Okay.
In a desperate attempt to open Kelly's airways, paramedics Karina and Mark are now pumping adrenaline directly into her veins.
Kelly, can you hear me? We're just helping you breathing, okay?
In my experience, most asthmatics respond to adrenaline. We'd expect to see some improvement in their breathing or in their conscious state, but Kelly just isn't responding at all, and it's really concerning.
Just a few hours ago, Anna was enjoying lunch with her daughter.
Kelly, I'm here with you, darling. You can do it, darling.
Now, she's struggling to understand what went wrong.
Come on, darling. We can do this. Come on.
Okay, Kelly, I'm just going to suction a little bit, okay, darling?
Her breathing started to go a bit funny, like shortness of breath, and then it got into deeper and deeper. In that moment, I was losing my daughter because after seeing her like gasping for air and turning blue and just looking at me in the eyes, and I was looking at her straight in the eyes as if she'd say, help me, Mum, but the words will not come out.
A swab and a 20, please.
As a parent myself, I just can't imagine what Kelly's mum, Anna, is going through in this moment. She's never seen her daughter so sick with asthma. It's all so foreign to her, and this is her absolute love and joy dying in front of her on the living room floor.
Her conscious state's still profoundly compromised.
Yeah. Kelly, squeeze my fingers. Squeeze my fingers.
The adrenaline infusion isn't working, and time is running out.
Kelly, open your eyes, darling. Kelly, open your eyes for me.
There's no doubt Kelly is one of the sickest asthma patients I've seen in my career. And right now, she's fighting for her life.
Every time I moved, there was this staggering pain going through here, which is where I think the heart is.
Nat and Leonard's patient, 75-year-old Robin, is convinced he's also very sick.
Robin's complaining of severe pain, but through our assessment, we don't find anything seriously wrong with him. He looks remarkably well for someone complaining of chest pain.
With a major heart attack unlikely, the team now has the task of figuring out what's really going on.
I was lying on my bed. I was scared.
Because the pain was so bad? Yeah. I just want to butt in, if you don't mind.
No, go for it.
What you're describing at the moment and what we can see on the monitor and the way you present at the moment, it's unlikely that this pain is coming from your heart. Rest assured,
that's good.
because I get the feeling that that's what you're concerned about.
Yes.
It's highly unlikely that what's happening is caused by heart or cardiac chest pain.
Thank God.
Okay, so I think that seems to be your main concern at the moment. Okay.
Yeah.
Robin's anxiety could be contributing to his symptoms.
Many patients that we go to are fearful that they're about to die or that some really bad medical event is happening to them. And often all they need is reassurance.
You've never had any diagnosed heart issues?
No.
No, so definitely no heart attacks?
My father died of a heart attack.
How old was he when he passed away from a heart attack?
61.
61.
Robin reveals to us that his father actually passed away from a heart attack, and it becomes clear that he is petrified. Robin really thinks that today could be his last day.
I think why I get so scared when something like this happens. It's difficult.
It's all right.
I might die.
That's all right, Robin.
For a grown man to start to cry and become very emotional about his potential death, it just goes to show how stressed and how confident he is that something terribly wrong is happening to him at the moment.
Does pain progress after you fall over onto the floor and then suddenly turns into some hideous knife blow?
It could. I'm almost certain that this pain is going to be related to you falling over. It's
That's a relief.
I think what we do is we get an absolute certain diagnosis from the hospital.
Yeah.
We don't think it's your heart. We think it's probably an injury, but let's be 100% sure.
With Robin's mind now at rest, the crew sets about managing his pain.
Bit of a sting.
Move.
I was a designer of clothing for
Were you?
endless years, so I was always choosing the model, of course. Have you ever tried to do it?
Try to do what?
Modelling.
No.
But you've got terrific bone structure.
Oh my goodness. Do I?
Yeah.
Thank you. High cheekbones?
Yeah.
Thank you. Robin's so much calmer now, feeling so much better, that he actually notices my high cheekbones. You hear that, Leo?
I'm listening and I know you're excited.
I'm just thinking, surely he's taken her height into consideration. If we see Nat walking down a catwalk, she's going to have to be wearing very high stilettos. You know, models have to be tall.
Let's get you out and get you checked out.
With both pain and anxiety now under control, it's off to hospital to find out the real cause of Robin's discomfort. Kelly is still fighting for life after a catastrophic asthma attack. Hopes of stabilising her breathing are fading fast.
At this point, I know that we're going to have to intervene. We're going to have to intubate her. We're going to have to put a tube down into her lungs and breathe for her.
Intubation is a risky procedure. Kelly will be placed in a coma so oxygen can be pumped directly into her lungs.
Atropine, 600 mics. And adrenaline, 100 mics a mil. If her heart rate drops below 60 at any point, she becomes bradycardic. I'll ask you to push the atropine. Okay? The entire dose.
If we have any problems with blood pressure, etc., I'll ask you to push 100 mics. So 1 mil. I'll explain it to you again when we do it.
So we've been forced to make the decision to take over Kelly's breathing. And when we do this, when you put a tube in somebody's airways, there's always the massive potential for complications.
We're just going to give you some drugs, sweetheart, some medication to make you sleepy, all right?
This is a really critical moment. Once we give those medications, we've only got a couple of minutes within which to successfully perform the procedure. And if we can't do that in those couple of minutes, then her oxygen levels will fall even further, and that's a dire consequence to her condition.
Just want to open the mouth for me?
To make way for the breathing tube, an instrument known as a bougie is used.
Oh, hang on. Bougie? Bougie?
Can I have the atropine in, please?
All right. So the bougie is in the trachea. It's a grade 1 view intubation. That's what we want to see, guys. A respiratory waveform.
The intubation has worked, but Kelly is still in grave danger.
Now that we've successfully intubated Kelly, she needs to be in hospital as soon as possible. And that's the next step in her care. But to get her out and to get anyone in her position out of a house is actually more complex than it seems.
Just so everyone is aware, she's now long-term paralysed with pancuronium, all right? So maintenance of this tube is critical. So if there's a risk, I'll just yell out straight away and we all stop immediately, all right?
So stop at any point, we stop.
Just say stop. Yeah.
Moving Kelly is a massive responsibility. She's sedated, she's paralysed, she's unable to breathe for herself. If we dislodge that tube at any point in this move, she's in massive trouble, and so are we.
All right, are we all okay? Yep. Okay, ready, set, go.
The team must now work seamlessly to lift Kelly to a waiting stretcher.
Yeah, pivot, I think, from Karina. You'll be going that way. You're walking.
So we're going to go out feet first.
You're going to go. All right, one more towards the centre of the room.
Okay, this one, I want half that movement, all right? Ready, set, go. Stop. Yep. Okay, is this the last movement, guys?
Last one.
Terrific.
30 centimetres.
Everyone okay? Yep. Ready, set, go. Okay.
Blanket's at the foot end. You can pull the blanket up.
Kelly has now been fighting for life for nearly 2 hours.
Kelly's body's just exhausted. We're doing everything we can to save her.
Kelly will now be rushed to hospital, where life support systems can continue breathing for her.
To be looking after Kelly as a 25-year-old female in the prime of her life is an enormous responsibility. Kelly's situation is grave. I'm really not sure how things are going to end.
Sweet. Anna, we'll take good care of her, okay? I promise you.
After seeing all the paramedics, I think then I went into my own shock, because seeing Kelly like that, it is a mother's worst nightmare. I thought, my God, what am I going to do? I've lost my little friend. I've lost her.
Nat and Leonard are now on their way to hospital with 75-year-old Robin.
You know, obviously, all of this made you quite emotional. Was it purely because your father was passed away at 61, or was it?
He was young. My mother died at 54.
From heart disease?
Heart disease.
Okay, so there's a strong family history for it. Okay.
After 2 falls, Robin's anxieties about death may have aggravated his symptoms.
I thought I was dying.
Yeah, look, I know, Robin, that you've got so many family members who've obviously had such a shocking run with heart disease, but I don't want you to feel like it's going to be your destiny because your family have also suffered through that. Oh, yeah.
That when you're on your own, particularly, that I was getting worse and worse into it, that I was going to die.
I had a lot of empathy for Robin. He wasn't just fabricating this idea in his mind that he was going to die. He's seen it happen before to his family. So it's understandable to get worked up because now he's got chest pain, and the last time his family member had chest pain, they passed away. So I totally empathise with him.
Okay. All good?
All good.
Excellent.
It's a nice feeling to be able to tell a patient that, you know, they're not having a massive heart attack. Sometimes, you know, that's all you can do for them, and it gives you such joy and pride to be able to give them that relief and that happiness. Yeah, I'm a big softie.
I liked Robin.
All he needed was to be told you're not having a heart attack.
Yeah.
And his mood just changed like that.
Yeah. And he was looking at me the whole time, so...
Did you ever think that you had good cheekbones? Because when he saw you,
Yeah,
you know,
yeah. I'm just so and say, what's my... Yeah.
you're going to be looking at yourself in the mirror non-stop. Oh, hello.
Okay. You want to turn around? Sure.
Oh, she's got pretty high cheekbones as well.
She
You're gonna have to let her go.
does.
She does.
She's got great cheekbones.
She's got great cheekbones and she's driving a Mercedes AMG.
Yeah. Oh, and she gave me a wave. She's looking at my cheekbones.
She's like, you and me are the same.
I know. We're twins. Yeah.
Miranda, this is Micah 30. We are on our way to you with an ETA of 20 minutes.
Mark and Karina are rushing 25-year-old Kelly to hospital. Since suffering a life-threatening asthma attack, she hasn't been able to breathe on her own. Now, only a tube to her lungs is keeping her alive.
It's our job to continue to breathe for Kelly and to keep her stable. This actually gives her the first opportunity to start to rest and recover.
Okay, we're settled for the time being and treading water nicely.
Kelly's mum, Anna, has been at her daughter's side throughout the ordeal.
I can't even begin to imagine what's going through Anna's head at this point. Every inch of her just wants to be touching Kelly, helping, and yet she sat there so amazingly controlled and supportive of her daughter in this hour of need.
Just swap fingers.
The bond between Kelly and me, she's just amazing to me. I've always said to her, I'll always be there, I'll always hold you, I'll be right next to you.
As a paramedic, you're always doing your best to try and save someone's life. But unfortunately, we know through our career that that's not how things always end up. Sometimes, no matter how hard you try, and with the best intentions, you can't always save someone's life.
Just a couple little bumps coming into the hospital.
The next 24 hours will be critical for Kelly's survival.
I know that Karina and I have done absolutely everything we can to give Kelly the best chance of surviving. And I'm really hopeful that that's the way things are going to end up, but I'm really not sure.
You excited? You ready for the big day?
Ready.
At the ambulance base, Taz and Amanda are keen to get on the road, but for an ongoing disagreement.
It's my turn to drive.
No, it's mine.
One they have an unusual way of resolving.
Show me your best Bollywood. If you dance better than me, you can go. Do it, do it, do it. And change your light bulbs. Light bulbs. These ones.
I think you win. You can drive.
How funny. When I first met Taz, the first thing he did was came over and said, "Hello, darling," and gave me a big cuddle.
That's my Aussie version.
He is such a beautiful human being. You know, they say put out to the world what you want to get back, and I think that Taz personifies that. I've had a lot of Indian practice.
Yes. I can see that.
Amanda is a beautiful, beautiful person and an amazing person to work with.
I can't believe I bet you at Bollywood.
And she makes the job fun and easy. She's a great partner.
We've just got a new job at the shopping centre. It's just been upgraded, so I've got to go through the lights.
Taz and Amanda's first job of the day is a Code 1 lights and sirens.
Roger received. Do you have a specific location?
They've been called to a man seen staggering uncontrollably near busy traffic.
Oh, here we go. Just passed out.
Now he's lying unconscious by the side of the road. They need to check he is still breathing.
Open your eyes. Open your eyes. Let's get rid of this first.
Yeah, it's around his neck. Let go of it, darling. That's it, good man. Have you had a bit of a vomit, eh? Yeah? Lift your head for me. That's it, good man.
I'm Taz, and I've got Amanda with me.
All right. You're all right, darling. We're here to help you. We're from the ambulance. You're all right. Hey, we're here to help you, okay? That's it, sit up for me. Once we approach the patient, we realise that he's actually covered in his own vomit and relatively unresponsive. So it's obviously either intoxication or drug affected.
We just want to make sure you are safe. You're lying on the side of the road. It's a busy traffic road. It's not safe here. See, you're passing out. You're not even answering.
With their patient drifting in and out of consciousness, Amanda speaks with eyewitness Jamie to find out what's happened.
I was going around the corner and he was a bit sort of only a few steps down and he was like standing up, struggling, swaying. And at one stage he wanted to cross the road and I thought, I knew it's not a good sign. I knew he was never going to make it. And then when I got to the garage across the road, he'd already passed out in the bushes.
Looking at this patient, it's pretty evident that he needs to go to hospital.
He's going to pass out again?
I think so too. The difficulty is how logistically that's going to happen.
You're not in a position to look after yourself at the moment, all right? What? So we got police members coming. What? We got more police coming. What? Police members.
No, this person wasn't nice. But I just feel that with any drug overdose, there's always a sad story. At times he was verbally aggressive, physically also, to a point that we had to involve police officers. But then, as a paramedic, we still have a job to do. We still have a duty of care.
We just want to make sure you're safe. Okay? That's the main priority.
Emergency services.
I'm at the scene of a car accident.
Whereabouts?
Anderson roundabout near San Remo.
At the Emergency Communications Centre, an urgent call has come through from country Victoria, where a motorist is desperately trying to escape her mangled car.
The car's wrapped around the power pole and her legs are jammed between the steering wheel and the seat, and the driver's side door had hit the power pole.
It's the second accident on this stretch of road today, and emergency services arrive quickly on the scene. "150 kilometres away in Melbourne, Micah Air Ambulance paramedic Matt is on his way to join them.
Did you know if they've got the road closed or we haven't got that?
I haven't got that information. There's somebody turning up at scene now, supposedly going to give us a further details.
Is that actually the scene? I can't actually see it.
The scene will be further down in this direction, just underneath your nose now.
Copy. Oh yeah, sighted.
Yep.
Yeah, visual.
There is a ambulance vehicle up at the lookout where we're going to.
Okay. Copy.
The driver has just been extracted from the vehicle and is receiving emergency care from a local ambulance crew.
Someone's checked that power pole as well. She's hit that at force.
As Matt makes his way to assess the patient's injuries, he inspects the wreckage for clues.
That's hit her in the back of the head, obviously 80 to 100 k's.
Yeah.
Swinging him backwards into the pole.
Yep. So that's obviously what's come back through and hit her in the back of the head.
And that's fiberglass, isn't it?
When you look at the vehicle, it's obviously been travelling at speed and has collided with the pole, causing the back canopy to actually come up from where it is, and it's speared through the back windscreen and into the passenger compartment. The potential is absolutely horrific. The canopy could be decapitating the patient or causing significant head injury to the patient, so we've got no idea what we're going to walk into here.
Yourself at the moment, all right?
Outside a Melbourne shopping centre, Taz and Amanda are now being assisted by police.
We're just going to get up onto the ambulance bed, okay? No, I'm all right, mate.
They need to get their drug-affected patient off the side of a busy road.
We're just concerned about you, mate. Need to be checked.
Because he's been abusive, checks are being made for any dangerous objects.
Nothing on his left. Sweet.
Eyewitness Jamie is shocked by what he's seen.
Why should paramedics keep saving your life if you keep taking drugs all the time and every time they come out and revive you and then take you to hospital and then you're back out there and doing it again? So why should they come and do that? You know, you're putting someone else's life at risk who might need an ambulance in desperate need. So, you know, I think it's really sad. I mean, you know, paramedics have one of the most dangerous jobs in the world.
How are you?
Not much.
You all right, mate?
Yeah, well, of course.
Hey. Listen to me for a second.
What?
If I let you out of this, are you going to behave yourself?
Yeah, of course.
You promise me?
Yeah, sure, yeah.
Pass me this arm.
Yeah.
There you go. Make yourself a bit more comfortable. How's that?
When it comes to dealing with people who have dependence issues, I think it's too easy for people to make that preconceived idea that, oh, you know, they're just a junkie, they don't deserve our respect. But at the end of the day, whatever their choices are is irrelevant to me. I need to be there to help them, whatever's happening with them today.
You're all right, darling.
Give me a shake or something.
Get you a what?
Chocolate shake.
A chocolate shake. How about I try and get you something at the hospital?
No, I want chocolate shake now.
Hey.
Oh, now,
Hey.
I wasn't aware that ambulances had chocolate milkshake as treatment, but he seems to think that we do.
Miss, please don't make a scene.
I'm not making a scene. I need you
are listening.
I need you to listen to me.
So stern Amanda comes out, the eyebrows go down, the finger comes out. Don't you swear at me. Don't talk to me like that. Are we going to be safe?
Put your hands down. Come on, down by your side. Hey, put your hands down behind your side.
Okay, we need the police now, please.
Hands down by your side. You need to listen to me. All right?
So our patient starts to muck around a little bit, and I'd rather call police than that result in another paramedic assault.
You're going to need to relax.
You're not cooperating. You're not.
We work as a team, so we always make sure that you have your one eye on your partner. With drug overdose or with people under the influence of drugs or alcohol, the mood can swing anytime.
Now under police escort, the team can proceed safely to hospital, where their patient will be given the care he needs.
Another life saved.
It's what we do. Yeah, we'll probably pick him up again next week.
So they're just doing their first proper assessment on her currently in the back. So
Air Ambulance paramedic Matt is at the scene of a horror car crash in country Victoria.
So that's obviously what's come back through and hit her in the back of the head.
Wow.
The driver is already being triaged, and Matt is about to find out the extent of her injuries.
Hello, Cherie. My name's Matt. Pleased to meet you.
She does have a hematoma and a lac to the right vesical region on the back of her head. It's quite big.
Yeah, okay.
The high-impact collision has caused lacerations to Cherie's head. The 49-year-old is lucky to be alive.
When you consider the force that's required to cause that back canopy to go up and spear into the back of her vehicle, potentially she could have been decapitated.
So I'm just going to have a quick listen to your chest, so I'll get you to do some more big, deep breaths for me, please. So breathing feels okay. The main pain is just at the back of the head?
Yeah.
And it's right at the back, is it? Or more on this side? No worries. And this collar probably makes that feel really nice, doesn't it?
Yeah.
No worries.
Incredibly, Cherie has survived in one piece. The same can't be said for her outfit.
The other thing I do want to do is cut off your clothes a bit so we can actually have a look and make sure we're not missing anything. So, unfortunately, all your nice, neat gear is going to need to give it a
dress. That's the first time I've ever worn it.
Ah, there you go. There you go.
This wasn't meant to happen.
We often get cases where the patients tell us they've just purchased something new or it's their favourite jacket and all that sort of thing. But ultimately, at the end of the day, we need to assess you properly. And if that means cutting through your best dress, then unfortunately it's going to have to go.
Cherie will now be airlifted to Melbourne's Alfred Hospital.
Come up.
Just taking off. Are you comfy there? Lovely.
Matt's main concern now is keeping her in good spirits.
Welcome to the cloud. That's all we can see anyway, so you're not missing anything at the moment.
I think to be able to operate as a good clinical paramedic, you have to be able to relate to people.
So what will I do? Just check out my head?
Yep, amputate, usual stuff.
Shave your head?
That's it. You're lucky I didn't cut off your ponytail.
Oh, you were hanging, weren't you?
Yeah, and the shears.
I thought so.
It's that thing that laughter is one of the best medicines that you can have, and it takes people's focus away from thinking about their injury and their illness that they've got, and sometimes just helps them relax. Just the small things like that can make such a big difference in the patient outcome.
You'll probably get an X-ray, may even do a CT scan.
Cherie will be admitted to the trauma centre to determine if she sustained any internal injuries.
Everyone good?
Yeah, good stuff. You know, I love my job. I'm 20 years in the job now, and I still, every day, more than happy to go to work. It's very interesting, lots of good fun. We get to help lots of people. And TLC is the best drug we have in our bag. If you give people lots of TLC, it makes an immediate impact on their care from the start.
Thanks, Matt.
I'm not behind you, you don't have to yell at me.
Okay. Yeah, well, keep trying to go.
It's several weeks since 49-year-old Cherie's near-death experience at the wheel of her car. After narrowly avoiding a major head injury, she was airlifted to hospital.
I had about 6 staples put in my head. They were taken out 7 days later, but I'm still got a lot of scarring and things still there, so it hasn't recovered properly. No, not yet. The first time I actually saw the car after the accident, I was totally shocked. It was 100 times worse than what I actually thought. It was like, oh, wow. When I look at the car now, I just realise how lucky I was. So lucky, and lucky that I didn't hit anybody else.
But Cherie's even luckier than was first thought. Emergency call maker Sally nearly didn't stop to help.
Apparently, because there was an accident prior, a lot of people actually drove past, but Sally noticed my headlights were on, so she stopped. I think she turned around and come back and checked to see that, and then she noticed somebody was in the car and was like, oh, what am I going to see?
Hi, how are you?
Good, thanks.
Good.
Today, Sally is here to meet with Cherie for the first time since the accident.
I remember being so shocked when I put my head in the cabin and I was talking to you and then just looking around and there was just shattered glass everywhere.
I was so grateful Sally was there. If she wasn't there, I might have done something stupid like try and climb out of the car. I could have really injured myself or hurt myself. But yeah, Sally kept everything calm.
And I'm glad that you're doing well too.
Yes, thank you. Yeah, I am. Thank you.
To know that she's doing well and to see her walking around today and she looks a darn sight better than she did that day, I can tell you, because that accident could have been a lot worse. Yeah.
I know I'm the one who went through the so-called trauma, but it would have been traumatising for you too. You didn't know what you were pulling up into. You didn't have to help. You didn't have to do anything. Nobody else did. You did. So thank you so much. Thank you.
As for 75-year-old Robin, who feared he was suffering a heart attack after a fall, X-rays revealed the cause of his chest pain was in fact 2 broken ribs. Robin was released from hospital the following morning and has made a full recovery. And it's been 2 weeks since paramedics Karina and Mark were called to 25-year-old Kelly's life-threatening asthma attack.
Last time I saw Kelly, she was gravely unwell, and since then, not a day has gone past that I haven't wondered about how she's going, and I've just been really hoping that she's pulled through this.
After 3 days in a coma, and against all odds, Kelly has made a complete recovery. Now, together with mum Anna and fiancé Maya, she's paying the crew a visit to say thank you.
Hey, how you going? Hi, Anna. How you going?
It's so nice to see you well.
Hi, Kelly. How you going?
You look so much better today.
That's fabulous.
Yeah, you look...
Thank you so much. When I see Kelly, I'm actually quite surprised by how emotional I am about it. It's incredibly rewarding and I actually get a bit teary.
You know, it was touch and go there, there's no doubt about it. And so, Karina and I have been extremely excited about meeting you again. Yeah.
So am I, actually.
Kelly was very excited as well.
So I stayed in ICU for 3 days. On the third day, I woke up and they took the tube out of my throat and I was able to breathe on my own. Doctors diagnosed me with pneumonia on my left lung, which caused me to have a chest infection, which caused me to have a severe asthma attack.
So obviously you've been an asthmatic since you were a little kid, is that right?
Since I was little.
Yeah, okay.
And I've just had no real good management over it.
Yep.
Mark and Karina have done so much. You know, they've saved my life. They, you know, brought me back to my family. If it wasn't for them, I wouldn't be here today.
Appreciate it so very much.
No, you're welcome.
You're more than welcome.
Yeah.
You're more than welcome.
I just want to thank you all as well, because now I get to marry my beautiful girl. Thank you very much,
mate. Fantastic. Congratulations. Yeah, absolutely. It's a very, very emotional experience to be involved in giving someone like Kelly a second chance at life. The fact that she's pulled through and she's made a full recovery is incredible. These sorts of outcomes, you know, in patients that are critically unwell and so young with their whole life ahead of them, it's an incredible experience to be a part of and absolutely why I joined the job.
Thank you so much.
Yeah,
Thank you.
Thanks.